Okay, hi everybody. Thank you for coming and for being here today. My name is Emma Ronaldo. I'm a clinical social worker at the Peter Gilgan Center for Women's Cancers at Women's College Hospital in Toronto, and I'll be moderating this panel today. So our topic today is breast reconstruction decision-making and the psychosocial process. So today we'll be having a discussion around the realities of breast reconstruction decision-making. Making a decision to have breast reconstruction or to choose not to have it is not an easy one to make. Whether you're doing prophylactic surgery or you have breast cancer, there's a process around deciding which option is best for you. So I'm going to introduce you to our four panelists who will offer their perspectives, both personal and professional, and provide insight around how to make a decision that feels right for you. So let me first introduce you to Shauna Rich. Shauna is a registered clinical social worker and psychotherapist with 20 years of experience providing psychosocial support, education, and advocacy to those with complex health needs. Over the past decade, she has worked exclusively in oncology with patients and families and has transitioned to private practice. Hi, Shauna.
Hi, thanks for having me.
And next we have Dr. Leanne Trachtenberg. She's a registered clinical and health psychologist working in private practice in downtown Toronto. She works as a scientific affiliate at the Princess Margaret Cancer Centre. Hi, Leanne.
Hi, nice to be with everyone today.
Welcome. And we have Erin Stadola. Erin was diagnosed with triple negative breast cancer at age 29. 2 years after a double mastectomy with immediate reconstruction, Erin had her implants removed and now has an aesthetic flat closure. Hi, Erin.
Hi, thanks for having me.
And last, we have Dana. So Dana Kendall is a social worker in private practice. She has had a single-sided mastectomy with delayed reconstruction, years later followed by a prophylactic mastectomy on the other non-cancer side with immediate reconstruction. Dana has been involved with Broad A for many years. She began as a sharer in the Show and Share Lounge and later chairing Broad A to then being involved as a speaker. Hi, Dana.
Hi, nice to see everyone.
So the panelists tonight will be answering some pre-led questions, and then we'll leave some time at the end of the session for some audience questions. So we'll start with the first question for Erin and Dana. There's an emotional process that occurs during the decision-making stage of whether to have reconstruction or not. Can you both speak to your experience and what the process of decision-making was like for you? And maybe you can also speak to sort of the emotional impact sort of throughout and following your decision.
Yeah, sure. I guess I'll start. For me, the decision-making process was very emotional. It took a lot of turns. I went through various stages of questioning my identity, what I wanted, what my partner at the time wanted, what society wanted of me. Like Emma said, I initially had reconstructive surgery because that's what's usually advised. So that wasn't much of a decision. I just went along with what my oncologist and surgeon recommended. Implants are amazing for a lot of women. I'm so happy this technology exists. Personally, I never felt comfortable with them after the implants, after mastectomy. So at that point, I was finished treatment and the dust settled a little bit. So I took a lot of time to think about what would feel right for me. So in the end, that was going flat and having explant surgery. At this point, I am very at peace with that decision. But yeah, of course, it did take a lot of soul searching and just listening really to what I wanted.
Okay, thank you. So a lot of personal reflection and time.
Mm-hmm.
Mm-hmm. So for me, I knew that I wanted to have reconstruction. That was always in the forefront of my mind. I honestly didn't think about the process and how involved it would be. And I would definitely recommend that people really do their research, because for me, it was absolutely, I'm going to do this. My surgeon was actually really great, that said to me, you need to heal not only physically, but emotionally, because I went through surgery and then chemo and then radiation. He then said, you have to wait a year, which was for me, it was, oh my God, a year is so long, but I'm so glad that I did, because you don't realize with reconstruction, when you've gone through cancer and through various treatments, you think, well, that's, the most difficult and everything else will be easy. It's not. Reconstruction is very involved, and it took more surgeries than I thought it would. I'm really happy I did it. I would do it again. I went back and did the other side. But I don't think I was emotionally ready for the various surgeries that I had to undergo. Especially for me, I had a latissimus dorsi, so they had to remove the muscle or push it to the front from the back. And I don't think I didn't get enough support when it came to all the treatments for cancer. Absolutely, I had tons of support and did my research. But I found for reconstruction, because for me it was absolutely, I'm going to do it. I wish I would have been more prepared for the difficulties of just being laid up for at least 6 weeks and not realizing how big the scar would be, which I was fine with, but just wasn't prepared. And just also the emotional roller coaster of going through it. We think only with cancer we're going to have the difficulties, and this is something that's so positive. And although it was very empowering for me, and I really did want this because it was a choice where cancer treatment wasn't a choice, so I viewed this as a choice. But I would just suggest to people that reconstruction is amazing if it's for you, but do your research and be prepared.
Mm. And it also sounds like taking some time as well was important for you.
Absolutely. Yeah,
Mm-hmm.
absolutely.
Mm-hmm. Great. Thank you. So the next question again is for Erin and Dana. What kinds of questions, I guess it's sort of related to the first one, but what kinds of questions do you suggest individuals should be asking healthcare providers prior to making their decision, about going through with breast reconstruction or choosing to go flat? I mean, I think that's something that I see in my practice. A lot of people are sort of wondering, what should I be asking? Or I wish I had asked that. So what would you suggest people should be asking?
Yeah, I mean, for me, similar to Dana, it was, I wish that I had had the full picture prior to mastectomy. It would have been a lot at that time to gather all that information, do the research on my own, but I really do wish that I had known the full picture. I felt supported throughout my cancer treatment, but ultimately I did just go along with what my oncologist and surgeon said. I wasn't provided with a lot of options. So, I would say just to try to get the full picture of the procedures, the recovery process, the results of reconstruction and of going flat as well. I mean, for example, I didn't know that I would lose sensation in the skin with implants, or that, I wouldn't be able to lie on my stomach. And these are just things that I felt like my plastic surgeon didn't really tell me when I was in his office.
Mm-hmm. Okay, that's helpful to know.
I would definitely ditto everything that Erin had said. I agree with everything. You need to know from A to Z exactly what's going to take place and what does that mean for you. And then to add to what she said, I would look at the logistical. If you have kids, or if you need to take off time from work, can you meal plan ahead of time? Can you organize that somebody helps you? Even just sounds silly, but I couldn't shower for so long and my hair was driving me crazy. And my sister-in-law came over and she washed my hair. I sort of leaned over the bathtub, and I would have never thought, she just said, let me come over and wash your hair. And it was just having those little, or somebody coming over, a friend brought over, a meal and ate with the kids and I mean, just the logistical things I would get organized, because like I said before, with cancer treatment, there's a lot of support and everybody wants to help you and bring food and do whatever they can. And for me, help me with my kids. But I didn't plan with reconstruction the same. And I think for people, they come in because it's cancer and they're dealing, but with this, especially for me, it was a year later, they were like, okay, she's doing well, she's okay. I didn't. And I know if I would have asked them, absolutely. And I found that I wasn't organized enough. And I would have said to people, okay, it's like when I was on chemo and people would take turns each chemo round to stay with me and my kids. I didn't do that with the various reconstruction surgeries. So I think you have to think of it in the same sort of genre as you do dealing with your breast cancer, because it is as difficult differently, but it is difficult because it's surgery, and like we said, there's all these emotions, and like Erin said, you don't, you know, going numb and not realizing it or not being able to lay on your stomach, so you can't sleep as well. I didn't realize, for me, because it was my back and my front, I thought, okay, now how am I going to sleep? Because on my side wasn't comfortable, and then, you know, I had to get a pillow, and I had to get, like, those things I could have done that before. So I really would encourage people to seek support, either by a group or by someone who's a professional. Friends are great, but they don't know the circumstances, and either a nurse or a therapist that you can talk it through with, not just the logistical, but all the emotions that go with that.
Yeah. Yeah. I think that's true. I think it's, sort of the practical and emotional implications of the surgery. And sometimes we forget about those little pieces. And I think those are really important questions and, information that we need to seek out. Mm-hmm. Yeah.
Absolutely.
Okay, so we're going to go to the third question now, which is for Leanne and Shauna. So both of you have supported individuals who are facing some emotional challenges around the decision to have breast reconstruction or not, and as well the type of reconstruction that's right for them. Can you provide some strategies and tools for coping with any sort of confusing feelings or emotions during this process?
Sure, I'll start us off. One of the things I was thinking about while Dana was talking was that when you're in the hospital, that's a time when you think, this is when I'm very, you're kind of in survival mode. And what sometimes people forget is that once you're out of the hospital and you're thinking about things like reconstruction, that can still be a very emotional time. And I know a lot of my clients sometimes don't realize that there are a lot of emotions that creep up once they're out of the hospital. So the first thing I want to say is how important it is to normalize that having all of those mixed emotions, whether it's excitement for the reconstruction or whether it's some sort of feelings of loss around your pre-cancer self, or whether it's just anticipatory anxiety for what's to come. Those are all very normal and important emotions to experience. There can be times when you feel like you want to suppress some of that, but realistically, suppressing it only really brings it back up to the surface more most of the time. So again, I'm just emphasizing the importance of acknowledging and letting those emotions exist in whatever way feels most comfortable for you. The only other thing I just wanted to add too was around the fact that when people are anxious and in emotional distress, sometimes it's very easy for them to focus on either their past or their future and never really stay present in the moment. And so sometimes some helpful strategies to manage our emotional distress can be things that keep us focused and grounded in the moment, things like breathing exercises, grounding exercises, mindfulness meditation. So those might be some additional helpful strategies to manage some of those emotions and chaotic emotions that you can experience at that time.
Absolutely. Thank you. And Shauna?
Yeah, so I would just add a couple of points to that, all of which are really the validation piece. I'm glad Leanne mentioned that. I also think it's important for people to have realistic expectations. And I think, in the oncology world, often from a healthcare professional standpoint, reconstruction is sort of seen as the cherry on top. We are going to reconstruct you, you are going to heal and go out and live your life, and that's going to make you feel better. So I think there's a bit of a misconception sometimes on just how challenging that piece can be. And that, in the survivorship phase or post-treatment phase, acknowledging just because you've had reconstruction or you've chosen not to have reconstruction doesn't mean that you're just ready to, move on with your life. So I think that's a really important piece, having realistic expectations around that. And then the second thing I would say when it comes to complex decision making is how important it is to consider one's personal values, your beliefs, your spiritual beliefs, all of those things I think really need to play into the complex decision-making process. And if you don't know how to sort of take yourself through that process, which I find in a lot of clients that I've worked with, they really don't know how to start digging into that to make the decision. To do that with a professional or a healthcare provider to really sort of understand what reconstruction might mean to you. In some cases, going flat is actually more in line with, people's personal preferences, their personal values about their body image, which we'll get into. So I think that it's really important in that decision-making process that people really dig in to what some of those deeply personal choices and, are. Everybody's so unique. And I think just because, women share a cancer diagnosis doesn't mean that, what's good for one person is going to be good for the other.
Mm-hmm. Absolutely. And, I think there's also this emphasis around, sexual identity and body image
Mm-hmm.
as well that sort of comes into all of that and within personal reflection and really thinking about, what is right for you, that all comes into question. And, I think, Erin and Dana, I'm not sure if, you can sort of speak to, your decision around reconstruction and how, that might have affected your sexual identity and body image.
Yeah, I'll start again. For me, I didn't realize how much reconstruction would affect my sexuality because breasts were never part of my sexual or any kind of identity. It was only when I had implants and they didn't feel like my natural breasts, they didn't align with how I thought about myself, that started to impact my body image in a negative way. That part of it made me feel disconnected from my body, actually. And I feel that being flat now, I am so much more present in my own body. I just feel like I'm all me. So now my chest actually plays a big part in how I see my body and how I love my body and the decisions that I've made for myself to get there.
Yeah, it's interesting because my breasts were a big part of my sort of sexuality, and losing them, or at least I lost one. And because I was a little bit larger, it was really awkward because I had one side that was completely flat for a year, and then I had the other side that wasn't. And that's actually something I wish I would have thought more about. But I was told, you only have cancer on one side. I think I would have done the other side prophylactically right away. But that's, it's amazing when you look back, when you're in the process. Cancer was on the top of my head. I was sad that I thought, okay, I'm going to lose my breast. And I really struggled with that. But I thought, okay, reconstruction was the answer. And it's interesting because I love the way that I look in clothes, but it doesn't feel the same. And I don't think women really talk about it. And I don't think that they get enough help around that because, like Erin had said, on the one side where I had the reconstruction, not the prophylactic side, but the side with cancer, it's cold and there is no feelings. And I know sexually in my own experiences, the sensations of my breasts were really, a big part of it. And now there's no sensation, but you have these breasts and you think, well, they should act the same. And in my head, I know that they can't and why they don't. But when you're not thinking about it and you're just expecting what it was like in the past, it's not. And I think women really need to look at that and they need to talk to somebody about it because it is, it throws you because now to be touched there, it's very sensitive, but not in the good sensitive way that it was. So that's now not become part of my connection with my sensuality and my sexualness. It's in clothes. It does. It looks great. I feel good. It looks better than it did before. I had 2 children and I nursed forever. So, I mean, I have these breasts that are very perky. I don't need to wear a bra, which all of that I love. But when it comes to having a sexual relationship, it's very different. And I think it's really important that women get help around that. And again, you can talk to your friends, but I think getting help from a professional is so important because friends don't understand. And there's so many different things tied to your sexuality and your body, and you don't even know what ends up, especially after a diagnosis of breast cancer is so impactful. I think we're not doing enough work about what is the emotional, physical, social aspect of having reconstruction or not, right? Both are very, I think they, but wouldn't you agree, Erin, that both need to have support around it and
Yeah, absolutely. I was lucky enough to find a great online support network of women who've been through a similar thing, who've chosen to be flat. And I just, yeah, of course, your friends are supportive, but it's in a different way.
Yeah.
Mm-hmm. And so, Leanne and Shauna, have you, what have you seen in terms of the impacts? What are some of the things that women can do to help around expectations around sexual identity and body image?
Yeah, I mean, we've already made some really wonderful points, but just from a research perspective, because I've done a lot of work in this area of research around body image, identity, and breast cancer in general, the research really shows that there's actually mixed findings when it comes to what people's preferences are around surgery. There hasn't been any clarity around that. Why is that? We don't know exactly for sure, but I think it's really around what we're talking about today, which is that, as Shauna said, it's about our values, those individual factors that make our sexual identity, our feminine identity important to us. And for some of us, that might be associated with our breasts. And for others, maybe less so. But it's about, as Shauna already alluded to, coming to terms with, even before the diagnosis of cancer, how important were your breasts to you when it came to your feminine or sexual identity? The other piece that I think is important that I just want to share, and I just thought of this as Dana was talking, is when I worked in a sexual rehabilitation center mostly for prostate cancer patients, we always used to tell couples to think about the fact that as they're returning back to their intimacy after cancer, it may feel like being a teenager again, because the ways in which you feel good in your body and connected to your body, and even that sense of feeling sexual in your body, might change now after cancer. So it's almost like relearning and trying to reconnect and re-understand your body in a different way. What feels good now versus what doesn't. And learning to, again, as has been mentioned, to acknowledge that those may change.
That's a great point.
Yeah, a really great point. And I don't have much to add to that, because I think that's so true. And cancer, I also think like it can be an opportunity to make things better in some ways than they were before. So sort of this idea of like, building resilience and growth through that process. And in a lot of cases, I've heard from people sort of when they come at the other side and they're able to kind of go through that grief and loss, they're really able to get in touch with who they are now. And that can be a really exciting process. But certainly, I also just want to say, like, for women who are, dating and not in a coupled partnership, it can be really challenging. And I really think that we have to sort of acknowledge the sexual impact and body image impact of breast cancer, like regardless of reconstruction. So it's a bit of a systemic issue because I think, again, people like putting in those realistic expectations and having people understand from the get-go that, their sensation, their sexuality, their image of themselves, their sensuality is all very much going to be affected, but there are proactive ways to kind of work through that. And I'd really love to see that as we move forward.
If I just comment on what both of you said, I think it's really important with what you said, and just my own experience, because I wasn't in a relationship. And part of that was, I thought, well, if I was in a 20-year marriage, would I go through all this? Would it be different? Would I, but knowing that I wanted to date again and I wanted to feel, whole. But it's not, your expectations are really important to know, what does that mean? Because you have this perceived notion, and I think you're right that you have to, if you can reframe it and say, you know what, now it's exciting. Now I can find new ways and different things. But I also think that you need to really look at, where are you? Because it's so individually based, right? Where are you? Where are you in your life? Are you in a relationship? Are you not in a relationship? How does that impact you? And like you both said, like, how does, what were your breasts like before? And then how can it be different? Because I do think with Reconstruction, we think it's sort of the fix all. And as Erin experienced, it's not, right? And for me also, in a different way, I'm happy I did it, but I think I think women really need to take a step back and ask the questions that you both just said.
Yeah, and I think, sometimes that process, it takes a while to get there, right? It's, as I'm not sure who mentioned it, but it's, you're sort of go, 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 you're on autopilot. When you have a diagnosis, you're trying to get through, and, your emotions can get put on the back burner. And I think sometimes they can pile up and come up later on in life. And, I think it's true. I think, a lot of reflection, a lot of talking about it. And when you're ready, and sort of acknowledging that and honoring that is really important. And, again, it's a process. And there's grief and loss associated, and all tied into that as well. Mm-hmm.
Absolutely.
Yeah. Okay, so we're going to go to our last question before we take questions from the audience. So the last question is around accessing support. So for Leanne and Shauna, in your experience, what are some of the common signs that tell you someone may need additional support? And, we sort of talked about it a little bit, but interested to know your thoughts.
Do you want to take
Sure.
that one first?
Yeah, sure. Why not? So perhaps a little biased as a psychologist, but I would say that, anytime is the right time to find and seek out that support. I always encourage people that it's not when you're at your lowest and you're in the most amount of pain and an extreme emotional distress that's when you go seek the psychologist. Or, I could label off all sorts of different symptoms that are associated with major depressive episode. But I think what I want to really emphasize is the value of finding someone, even when you're feeling relatively okay, just to process some of these things we've talked about, like expectations and values, to keep you kind of steady and able to manage them, and provide some tools and techniques just to help you along the way when maybe, things get a little bit more tricky down the road, and those emotions kind of all of a sudden are a little hit closer to home. So that's something I always like to emphasize when that question is asked. Shauna, do you have anything?
I think that's so important, Leanna, and I think I always say to individuals who I meet, it's really important to be proactive rather than reactive, right? And let's sort of get ahead of it, and, let's talk about these really difficult things early on, instead of, it's sort of falling on us later on.
For sure. And I think what often happens with the, cancer treatment trajectory is you're just so overwhelmed by the diagnosis, and then the actual treatment is like, a lot of people just sort of put their head down to kind of get through it. And it's sort of the after shockwave of like, what just happened. So I also agree about being proactive and accessing, resources and services as soon as possible. I think for a lot of people, understanding, having sort of the emotional insight to sort of understand their distress tolerance and kind of where they're at is really important. Again, before things, get out of hand and out of control. So yeah.
And I guess for everyone, where, Erin and Dana, where have you found support sort of in the community? And, to Leanne and Shauna, what sort of supports or resources are out there for people to access?
I was lucky enough to be able to speak to a psychologist before I had reconstructive surgery. This was on my own. And I found it super helpful. I needed an outside perspective and someone to talk through it with me. But I know, I mean, depending on where you're being treated, there are often services through the hospital and through where you're being treated to be able to talk to a social worker or something like that. But I've also found it very useful to speak to other women online. You know, Facebook groups have been really great for me to just find people who are in the same situation.
Yeah, and I think I had a social worker that I was working with that helped. The only thing that I wish I would have done, I was dealing more with the cancer aspect. I didn't deal with the reconstruction, because for me, the reconstruction was sort of the answer, right? For me to get my power back. And I felt empowered because it was a choice, right? Where, as I said before, cancer wasn't a choice, but I didn't do the work around, okay, how will this change? Where are the difficulties? Because I did think this was the answer. And I would feel better about my body, and I would be, and I think that's important to do the work of beforehand and during the process if possible. And it's great that there's so much online, because now with everything going on, it makes it much more accessible.
Yeah, I would just add that in addition to the psychosocial programs in some of the hospitals, there's amazing community resources. There's organizations like Wellspring and Gilda's Club and Rethink Breast Cancer and Canadian Cancer Society, you know, as well as private options for people who can access that. But I think there's a lot of really great peer support and community options available, especially in the breast cancer space, which is lucky. Not all cancers have that. So there's really good support out there. And I think for me, like, witnessing the power of peer support is pretty impactful. Being able to connect with people who've walked in your shoes, or, you know, have a sense of what you're going through and can kind of mentor you through and be there is really, really powerful, and sometimes more powerful than, you know, seeing a professional one-on-one.
Yeah, I would also. Oh,
can I add one thing before Sean?
Sure.
One of the things I did, which was really interesting, is I joined a dragon boat racing team, and it was all women who had breast cancer. And it was interesting looking at it as a social worker and through a therapeutic lens. It was so therapeutic, but you don't necessarily have to go to a therapist or go into a therapy type group. There's other, because we had this unspoken connection, and it was really positive because we would work out and we'd be exercising. So I just wanted to say there's also that sort of realm. Also, if people are saying, well, I don't want to go into therapy, I don't want, there's so many different types of support. Anyway, sorry.
No, that's okay. I mean, just to add to your point, from the research that I've done around body image, I think just the power of moving in your body and feeling that connection to your body through movement with other women, I mean, sounds wonderful. And I know how amazing those dragon boat teams can be for women. The only other point I was just going to make was around, did I lose it? No, it was around the value of really the value of groups. I mean, again, as a therapist, I do value having a facilitator in these online groups, but just to Shauna's point as well, just being with a group of women who have gone through the same type of experience. And there's so many of them out there right now, particularly online, whether it's text-based groups through Cancer Chat Canada or these Zoom type of groups. So many of them are available for breast cancer patients. So it's definitely another form of support that I very much think adds a lot of value.
I also would just add one other point that, because I've been starting to see a lot of couples in my private practice, and I think that that's another area that, you know, can be really helpful for people who are partnered, you know, seeking couples therapy around some of the intimacy issues, connection, all of those things. So there's some really good therapy out there for that as well.
Mm-hmm. Absolutely. Okay, so we have a couple questions coming through. We'll just spend a few minutes answering those before we finish up. So the first one says, I have decided to do a flat closure. I don't feel like my partner agrees with my decision. Any tips on how to talk to my partner? Anyone wants to take the lead on that?
Erin, why don't you take the lead?
Yeah, I'll take the lead just because I was in this exact situation. I was in a partnership when I was going through Reconstruction and the decision to go flat. And it was, very hard to talk to my partner about it. And that it was very stressful. I'm not going to say it wasn't. I mean, my advice, I guess, if I have any, is just to, keep lines of communication open. We did go to counseling together to work through some of the things that we maybe didn't even realize that were underlying issues. But, in the end, this was definitely the right thing for me to do. I feel great in my body. I knew that deep down, this was the thing that I needed to do for myself. And I'm so glad that I listened to that and didn't let, my partner or anyone else, anyone else who, directly or otherwise, tried to influence what I needed to do with my own body.
Mm-hmm.
I love that, Erin. I just think it's so true, like your body, your choice. And while I get that, partners are deeply impacted by their loved ones making these decisions and just being diagnosed with cancer in the first place, I think it's really important to be really solid in your choice and then be able to support your partner perhaps to even get their own support around their feelings, and keeping the channel of communication open is great advice as well.
Yeah, and if I can just add, definitely, I think, as Shauna had said, doing couple work is really important. But I also think it's really important, as everybody has said, is just be really clear with what you want, because it's very hard not to have partners or family or friends influence one way or the other. You've been through so much, you don't need to have this, or going flat, it's such a personal choice. And I think it's really important to really be solid, because then you can let other people's voices influence you, and then it gets really overwhelming and confusing. Mm-hmm. But I think it's also important that the partner has a voice, because it can be really scary for them, whichever way you want to go. And I think that they need to have their own support, because it is so, it's usually all about the woman and what she's going through, but we don't realize how impactful it can be on the partners, and they might be so nervous to say the wrong thing that, having someone, a professional or a group, would be great.
Okay, so we're just going to go to one last question. We're talking a lot about women and breast cancer, and this question is directed at what about men? So what about men who, get breast cancer or affected by breast cancer? I don't know if anyone can speak to sort of that, their experience. Mm-hmm.
I mean, I think that, we exclude men from the breast cancer conversation a lot. Again, it's sort of a top-down problem, systemic problem. I think that, men go through their own body image issues, a diagnosis of breast cancer. There's so many psychosocial implications for men who are diagnosed that I think, we have to be cognizant of that, and really, organizations need to do their part to be inclusive. Hospitals, institutions need to do their part to be inclusive and speak to men as well in their marketing materials and everything they do. And, I would also say men need to get support and have access to that, especially because, that's not necessarily their go-to framework.
Mm-hmm.
Leanne, I don't know if you want to add to any of that.
Yeah, I think you are completely right in everything you're saying. The only thing I will add is someone who has done research in the field of breast cancer for 10 years now. I just want to emphasize that there's so much more research that needs to be done in this area. It's so limited. We don't know enough. And especially when we talked a lot today about our identities, our sexual identities, but also we talked a lot about our feminine identities. I think we need to broaden that term to just gender identity, really, to understand also the man's perspective and what it would mean to have breast cancer. And so I think all I can say is there is so much more work that needs to be done from a research perspective when it comes to understanding where they're coming from.
Absolutely. And I think, we can also say for the queer community and for anyone, who's
Yes.
sort of experiencing breast cancer or breast reconstruction, however they identify, I think there's a lot that needs to be done in this area.
Very good point.
Yeah. Okay, so we are now coming to the end of the session. Just to sum up, so breast reconstruction is a deeply personal choice. There's no right or wrong choice. What we know is that information seeking and asking questions, accessing support, and personal reflection are really important pieces to making a decision that's true to your values and preferences. I would like to thank Dana and Erin for sharing intimate details and for being so honest and forthcoming about their experience, and to Leanne and Shauna for providing insight into the psychosocial experience of breast reconstruction decision making, as well as providing information for resources and support. This is a conversation that needs to continue. It's not just a one-time thing, and I think there are a lot of gaps that need to be addressed as well. And I think if you wanting to continue the conversation, there are forums such as Canadian Cancer Society where you can, ask these questions. I'm going to share my screen just so that hopefully this works. If you are searching for more answers, if you still have questions, you're wanting to continue the conversation, you can go to Cancer Information Helpline. Inquiries are answered by professionals who can provide evidence-based information and support. If you are looking for resources, you need help finding these resources, Community Services Locator is available. It's a searchable database that uses filters to help individuals find the specific service they need on location, type, cancer diagnosis, language, and more. And if you're wanting to continue the discussion online, you can visit cancerconnection.ca, which is a virtual community where no post goes unanswered, and you can connect with others who are having a similar cancer experience. So I just want to thank everyone again for being here today, and let's continue the conversation. And I hope everyone has a great day.
Thanks, Emma.
Thank you.
Bye, everyone. Thank you.
Bye.
Bye.